You and Your Money is brought to you by Doctors Hospital Health System.
Welcome everyone to You and Your Money. I'm your host, Javon Butler, and co-hosting the show with me today is Alexis Burrows, Marketing Director at Doctors Hospital. Alexis and the other Doctors Hospital team members will be joining us every month for the next few months to keep the public aware of all of the great things and initiatives that are happening at Doctors Hospital Health System and how it makes healthcare more accessible and affordable for all. Alexis, welcome to the show.
It's a pleasure to be here, Javon. How are you doing today?
I'm doing fantastic. It's great to have you on. So let's jump right into it. So Alexis,
Awesome.
Who do you have joining us on the show today and what will we be talking about?
Okay, so today we're going to have two members of our pharmacy leadership on the show. The first is Dr. Ivis Turner, who is our pharmacy manager here at Doctors Hospital. And she's going to be talking about COVID treatments and where the pharmacy and prescriptions kind of sit in that space when it comes to the treatment of COVID-19. We also have joining us today Ms. Michaela Stubbs, who is a clinical pharmacist in the health system.
Okay.
And she'll be talking about our Pick Up Now, Pay Later initiative, as well as remote fulfillment of pharmacy and prescriptions in the hospital and in the health system at large.
Okay. So you have a lot of initiatives going on. Pick up later, pay now. Seems like you're really getting into the pharmacy space. I just want to take this
Pick up
opportunity.
now, pay later.
You pick up now, pay later. Thank you. I just wanted to go back. We had Dr. Diggis on the show last year, and some of the issues that he mentioned, he spoke about the pandemic and how it reduced patients' confidence in the use of healthcare facilities. Are people still afraid of contracting COVID while they're receiving healthcare services?
So I guess what we should say when we start to talk about this is, the hospital or the health system's safety protocols begin upon entry into the health system.
Okay.
So first things first, all patients are screened for COVID-19 upon admission, whether they're coming in through the ER or by ambulance transfer. And this informs us as to whether or not, this patient would need to be treated in one of our negative pressure spaces, which is dedicated for COVID-19 patients.
Okay.
After admissions into the health system, patients are also screened weekly or more frequently for COVID-19, depending on their symptomatology. Beyond that, when you start to think about patient visitors, we've switched up our approach to this by allowing patient visitors only through an appointment-based system.
Okay.
So that also allows us to screen visitors to patients before they come into the space. And this entire process is handled by our patient experience department. Beyond that, our associates also go through weekly testing for COVID-19, and they're also required to complete a daily COVID-19 assessment form before they come into any space in the hospital. So that's whether it's the main facility or one of our satellite locations.
Okay.
And if an associate does unfortunately present with COVID-19, they would have to go through a series of health protocols through our associate health team, as well as they would require a negative COVID-19 test before they return to the health system.
All right. Several weeks ago, we had the uptick with the Omicron variant. Did that impact any of the elective surgeries performed at doctors? And if it did, people now able to come back in and have those elective surgeries performed?
So we have had issues with elective cases during COVID-19, particularly with the surges. So looking at the Delta wave in 2021 and the Omicron wave a few weeks ago. But we've taken a number of steps to accommodate the needs of our patients when it comes to surgery. So we opened our ambulatory surgical center in late 2021, which allows us to offer same-day cases for patients that require up to 23-hour surveillance or monitoring and recovery post-op. This also allows anyone who needs surgery but does not require hospital admission post-op to have their surgery outside of the main facility. And then during times where we may have a higher number of patients within the main system, we also have the ability to relocate COVID-19 patients from Collins Avenue to Doctors Hospital West. So that allows us to free up capacity in the main hospital for surgical payments requiring hospital admission post-op. And then beyond that, just in terms of the daily tracking and measuring of what's happening in and around the health system, we have a daily utilization and capacity huddle with our entire clinical leadership, inclusive of our VP of Surgical Services, Dr. Wesley Francis. And this allows us to ensure that all of our teams across the health system are aware of what the room needs are within the system. And then one of the other things we're doing, just to pivot back to your original question, we've also stopped cohorting patients in rooms. So basically, if you're coming into the hospital to be admitted, you're going to have a room to yourself. So that also allows us to kind of, control and halt the spread of COVID when people are coming into the hospital environment. And then just in terms of surgery in general, of course, we always have accommodation for emergency surgery services. Mm-hmm. So we have an array of specialists in our surgical suite that are able to perform surgeries in the health system. And obviously now we have both the main facility as well as the ambulatory surgical center at Centerville Medical Center on Collins Avenue and 6th Terrace.
Okay, sounds like there are a lot of moving parts going on right now, but in terms of the LAMP initiative, the Loyalty Advantage Membership Program, this was something else that Dr. Degas mentioned the last time he was on the show. Tell us briefly about the program's benefits, particularly for persons who may have lost their job and subsequently their insurance due to the pandemic.
Right. So one of the things that the hospital has been focused on in the past few years is trying to make healthcare more accessible and more affordable. Mm-hmm. And LAMP sits squarely in the middle of our initiatives in that way. So membership in LAMP offers a wide variety of benefits, including free primary care visits at every tier of the program, free annual physicals, discounts or waived copays on lab services and prescriptions, waived copays for imaging for insured patients, or 2 free scans for uninsured patients, free mammograms, discounts on outpatient rehab, inpatient admissions, same-day surgical procedures. Basically, it's a laundry list of things that you get discounts or copays waived for depending on where you sit. Okay. Now, obviously, we know that a lot of people have been impacted by COVID-19 when it comes to their employment situations and their insurance situations. So we have 4 tiers of the program now as of January of this year. We have our new entry point, which is LAMP Access, which is entirely free for new members and comes with it's a specific set of benefits. We also have our insurance supplement plan for members who have pre-existing insurance. And we have our prepaid primary care plan for uninsured patients, and also a plan for NHI members who have signed up with Doctors Hospital as their NHI provider. So in the paid plan space, we have plans that start as low as $33 a month. And then obviously we have 2 tiers that are free, which would be LAMP Access as well as the NHI plan. So for us, like I said, it comes back to that idea of trying to make healthcare more accessible, more affordable for everyone. Yeah. And that includes things like LAMP, things like our Pick Up Now, Pay Later initiative, which Ms. Stubbs is going to talk about a little bit later, as well as discounted pricing like what we're offering now in February for our CT coronary angiogram as a part of Heart Health Month. So basically our approach is whatever we can do to make this access to healthcare more accessible, more affordable, that's kind of where we're trying to exist in the space in healthcare at this time. Okay,
so Alexis, we have to take a quick break, but once we come back, let's speak with Dr. Turner about COVID-19 treatments and prevention. This is You and Your Money. We'll be right back.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases including rheumatology, dermatology, gastroenterology, and endocrinology. We provide quality, highly specialized care, seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com.
I'm Dr. Wanda Rogers.
Hi, I'm Dr. Munish Sharma.
Hi, I'm Dr. Valencia Johnson,
Director of Ambulatory Services at Doctors Hospital.
I'm the Director of Imaging at Doctors Hospital.
I'm a pediatrician here at Doctors Hospital.
I am vaccinated against COVID-19.
I'm fully vaccinated against COVID-19.
I am fully vaccinated against COVID.
Are you?
Are you?
Are you?
Welcome back to You and Your Money. I'm here with Doctors Hospital Marketing Director Alexis Burrows, our co-host for this show. Alexis, would you please introduce your colleague who has joined us for the segment?
Today we have Dr. Ivis Turner, who is our pharmacy manager here at Doctors Hospital Health System, and she's here to talk to us about COVID-19 treatment and prevention. Welcome to the show, Dr. Turner.
Thank you. Thank you for having me. It's a pleasure to be here.
Thank you for joining us.
Yes, thank you. So I want to first talk about the current threat of coronavirus. While the number of patients who require hospitalization has been down, we have seen an increase in the number of individuals testing positive for COVID-19 within recent weeks. What do you attribute this to, and what are your thoughts on the belief that contracting the coronavirus or COVID-19 is inevitable?
Well, as it stands, Alexis, data provided by the Ministry of Health and Wellness shows that the infection rate for COVID-19 in the Bahamas is trending downward, which gives us a great sense of relief, right? We did have an increase in COVID-19 diagnoses from the end of December into the end of January. I would say it's primarily due to the increased traveling to and from the Bahamas, and increased gatherings, of course, given the holiday season. You know, we tend to become more relaxed and comfortable and trusting when we're around our loved ones, and we let down our guards. So there's an increased contact with others, things like sharing of serving utensils and even restrooms, things that we tend to kind of put aside and not think about when we're around family members. Enjoying food with our masks down for extended periods of time. All these things, I believe, they have contributed to the increase in case numbers. Now, to answer your second question, when you say that, you know, contracting COVID-19 is inevitable, I would, you know, if you say that it's inevitable, you're saying that it's unavoidable, which I don't agree with. We have a lot of information that's readily available that tells us how to avoid contracting coronavirus. So standard risk reducing responsibilities, you know, encourage that. These include wearing the proper mask, protective mask, washing our hands routinely with soap and water, using sanitizer in between, washing, of course, to reduce the lingering germs that you may contract if you're touching surfaces, wiping areas before you use them, such as tables and chairs, especially when you go into the public areas, social distancing, of course, and routine testing is warranted, you know, just to prevent spreading if you happen to contract COVID-19.
Right. So you mentioned testing and routine testing. How often should people be getting tested for COVID-19?
Well, I think this should be guided by, of course, your risk of exposure, right? Or if you are experiencing any symptoms of COVID-19, signs or symptoms of COVID-19. So, you know that in areas where you serve the public or where you have a heightened risk of exposure, so in healthcare areas, public clinics, and even the hospitals, you want to ensure that you're testing routinely, you know, let's say about weekly or even every 5 days. Because of course, we know that symptoms tend to show themselves after 5 days or so of exposure, 5 days to a week after exposure. So you want to have routine testing as such. If you do experience symptoms, like I mentioned, you want to have a wait period of about 5 days or so before you test, because you don't want to increase the risk of getting a false negative test, which can happen in that extended incubation period. So, you know, the incubation period can be anywhere from the first day of exposure up to 14 days after initial exposure. And of course, you want to get tested anytime there's a public alert. So if you have a public health official that would have released any advisory to get tested for any population or any area, any demographic, or even if your personal healthcare provider recommends that you get tested, you want to get tested.
Right. So obviously you talked about symptoms, and one of the things that we've seen is that symptomatology has changed depending on which variant is going around, that sort of thing. So what are some of the symptoms that people should be aware of right now in terms of that they might not be have been previously aware of that might be a current indicator of COVID-19? And then what are some treatments that you would recommend to alleviate COVID-19 symptoms?
So most of the symptoms that are presenting themselves, most of them are similar to what we've seen before. Even some are similar to the common flu symptoms. So you're looking at high temperature, continuous cough or uncontrolled cough. You still have the loss of taste or smell that can be existing in the symptoms. You have now your runny nose, especially with the Omicron. You have your runny nose, your sore throat, and sneezing, which are even similar to the cold. So you want to be even more cautious, and this is where the testing comes in. Like I said, you want to get tested, about 5 to 7 days after the onset of symptoms, when your viral load is probably going to be at peak. There's also evidence that there's some nausea accompanying the Omicron symptoms, and even lower back pain that may lead to the entire body muscular pain or body aches. Right. In terms of treatment, now if you're in a mild to moderate, manageable COVID-19 type of area where you're not severe, you're not approaching severe, you're not at a heightened risk of experiencing severe COVID symptoms, then you can look into your easily accessible treatment regimens or your over-the-counter regimen. So you want to look into, of course, your Panadol, your Tylenol, which is easy to obtain in your pharmacy, in your nearby pharmacy. Additionally, you can look into mucolytics. So when I say mucolytics, these are medications that would decrease the risk of increased congestion or decrease the risk of hardened mucus in the body. So you want to get that mucus out. You want to release it, expel it, cough it out, or so forth. Additionally, you have your antihistamine. So you're looking at your Zyrtec, your Claritin, or even the older ones like the Benadryl and Histal to help to relieve the congestion, the nasal congestion specifically. And just to touch on some examples of the mucolytics, you have Mucinex, that's a very popular one. You also have some of your Histal products that contain the mucolytic guaifenesin, and then you have your Bisolven. Now, outside of the medication area, you want to look at your other nutritional aspects. So you're looking at your you want to continue to have warm or hot tea routinely throughout the day. The traditional honey and lime is still recommended. Also, you want to make sure you're hydrated. So you're looking at what we have all around the Bahamas, your coconut water. That's the best option, I believe. In addition to that, you can purchase, things like electrolyte supplements, so your Pedialyte or your Gatorade, but of course you want to be cautious of the sugar intake.
Sugar, yeah.
Okay, Alexis, that is a lot of information we just received.
That is a ton of information.
Dr. Turner, we really thank you for joining us today. I think the public has a better understanding of all of the different precautionary measures they can take and what they should be looking for in terms of symptoms when it comes to COVID. Thank you for joining us.
Thank you.
Up next, we'll talk about the Pick Up Now, Pay Later initiative at the Doctors Hospital Pharmacy. Stay tuned. We'll be right back.
Doctors Hospital's Pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Hi, I'm Dr. Rajesh Pahawa.
Hi, I'm Dr. Jazreel Thompson,
infectious diseases physician.
I'm radiologist at Doctors Hospital.
An anesthesiologist here at Doctors Hospital.
And I'm fully vaccinated against COVID-19.
I'm fully vaccinated against COVID.
I'm fully vaccinated against COVID-19.
Are you?
Are you?
Are you?
Welcome back to You and Your Money. Doctors Hospital Health System is making access to medication easier with its Pick Up Now, Pay Later initiative. Joining us is Michaela Stubbs, clinical pharmacist at Doctors Hospital. Good evening, Ms. Stubbs. How are you?
Hi, good evening. I'm well. Thank you for having me. Happy to be here.
Thank you for joining us. So, Ms. Stubbs, what is this new initiative? Walk us through how it works.
All right, so the Pick Up Now, Pay Later initiative is a concept designed to not only increase medication accessibility and affordability, but it also promotes medication adherence. Simply put, we want to place medications in the hands of our patients, removing the hassle of upfront payments at the time of collection. So patients are now able to pay within 14 days of receipt with 0 hidden fees. We've added a bonus to this promotion, which allows for remote medication pickup at any one of our approved participating sites. So the patient may now request their medication and also request to collect their meds at a location that's convenient for them. Currently, the Doctors Hospital West on Blake Road has been onboarded for medication collection for those living in the western areas. But stay tuned, because there are a number of additional sites that will be onboarded in the upcoming weeks to facilitate those living in the east and, of course, central to Providence.
Okay, and this initiative started when, and is this something only being offered during the pandemic, or is this going to be an ongoing initiative?
So as of February 1st, all self-pay patients are now eligible to receive an automatic 20% discount off of their prescription meds. And those who are insured will benefit from out-of-pocket waivers, essentially collecting their medications and walking away without payment.
Okay, that really is an incentive for both the out-of-pocket payments as well as the insured. Is there a minimum order total required, and are there any restricted medications during this initiative or on participating initiative?
All right, so there is no minimum order total required. The number of medications requested is completely up to the patient. And of course, we will evaluate certain requests, particularly those for specialty items, on a case-by-case basis.
Okay. So, Ms. Stubbs, what payment methods do you presently accept?
We currently accept cash, any form of credit, and most major insurances.
Okay. Alexis brought us up to speed earlier about the hospital's Loyalty Advantage membership program. Can Loyalty Advantage members use this plan with this new offer?
Certainly. Our Loyalty Advantage members are eligible to participate within this program while enjoying the existing benefits that LAMP has to offer, whether it's a waiver on their out-of-pocket payment for insured or the 30% discount for self-pay patients. So they are certainly welcome to join this new initiative.
We know that the retail sector is experiencing lots of shipping delays and shortages due to the pandemic. The supply chain is now starting to fill back up, but there's still a lot of delays on various items. How has the pandemic affected the availability of medications at the pharmacy?
Well, we have certainly not gone untouched as it relates to delays in medication procurement and shortages of critical medications. However, we have had to strengthen our ability to prepare and respond to these changes in an effort to ensure that medications are readily available for our patients. We've expanded our vendor search within a number of regions, such as the UK and Canada, to increase the likelihood of sourcing these critical medications. We've also utilized our existing and real-time data on medication utilization for greater visibility on our baseline, which really gives us an idea of the number of days on hand for key medications, allowing us then to forecast demand and determine the likelihood of drug shortages. With all of this, we have to keep our physician base abreast of these shortages. And we do this via inventory alerts. We keep them aware of medications that may be completely out of stock or those that are critically low. And this allows them time to review therapeutic alternatives in an effort to avoid any disruptions in the patient's therapy.
Okay. Michaela, we definitely want to thank you for coming on this segment, on the show. I can see that you have pharmaceutical needs under control and you've provided us great ways to pay.
Thank you. Thank you.
This is You and Your Money. We'll be right back.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases including rheumatology, dermatology, gastroenterology, and endocrinology. We provide quality, highly specialized care, seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com.
Welcome back to You and Your Money. I'm your host for the show, Javon Butler, and I truly enjoyed having Mr. Alexis Burrows co-host the show as he is the marketing director at Doctors Hospital. Alexis, a lot of information, timely,
Yes.
Informative. I really want you just to recap everything that was mentioned this evening by Dr. Turner as well as Michaela Stubbs.
Right. So we are very grateful to have Dr. Turner and Ms. Stubbs on the show today. A lot of good information about some of the options in terms of the treatment of COVID-19 and some of the prevention. I know one of the things that Dr. Turner didn't get an opportunity to mention was we're offering an outpatient infusion 3-day course of remdesivir as one of the treatment options for COVID-19. So if anyone's interested, they can take a look into our infusion center. And then also, our LAMP benefits. There are so many options for LAMP. One of the things that we've been doing is actually been hosting LAMP pop-up events. So our next one is going to take place in early March at the Mall at Marathon. So stay tuned to all of our social media channels to get more information about that. For all information about pharmacy, you can visit the Doctors Hospital website and click on the link that says 24-hour pharmacy, or you can call them at 302-4785. We're located primarily in the main hospital right now, but for our pick up now, pay later on our remote fulfillment options, you do now have the option for using Doctors Hospital West, and we'll be announcing a number of additional locations for those in the upcoming weeks. But just in terms to wrap up, of what the hospital has been doing, we've done a lot of work in the past few months and the last year or two in terms of trying to transition outpatient services out of the primary location at Collins Avenue. So we talked about the ambulatory surgical center, at Centerville Medical Center, but also housed in there is our specialist clinic. So that's no longer in the main hospital, that's at Centerville Medical Center. We've recently launched our internal medicine specialist group at the Luton Building on Dalesville Street, which also houses our infusion center. And then we've done a lot of other adjustments in terms of just moving things around and making the hospital a lot safer for our patients. So we encourage you, if you want any more information about our pharmacy initiatives, our LAMP initiatives, take a look at our website. We have a link to the LAMP information. We have a link to our pharmacy. And anything else, you can check us on social media, Doctors Hospital Bahamas. We're on Facebook, Instagram, Twitter, LinkedIn. And we're happy to answer any questions that you may have.
And Alexis, of course, we're going to make this a recurring monthly program. So we'll be excited to hear from you next month to get more information on what's going on at Doctors Hospital. Thank you for joining us. Thank you for being co-host.
All right, thank you so much for having us.
Yes. This has been You and Your Money. We thank you for joining us. Good night. God bless.